Good afternoon and welcome to today's webinar on infant and toddler homelessness across 50 states, 2021 to 2022. We are so glad that you joined us for today's session. My name is Erin Patterson. I am Director of Education Initiatives at SchoolHouse Connection, and I'll provide some introductory remarks and reminders and then turn it over to my colleague before we get into our meaty discussion today with our illustrious panel of state experts. Just to start, in case you're not familiar with SchoolHouse Connection, we are a national nonprofit advocacy organization, and our mission is overcoming homelessness through education from prenatal to post-secondary. And we work at this mission in a number of ways, including federal and state policy advocacy, practical assistance to early childhood development programs, K-12 school districts, and institutions of higher education to help them understand the impacts of homelessness and legal requirements. And we always say the jewel in our crown is our network of young scholars who have experienced homelessness and who we are privileged to support through post-secondary financial assistance and case management support. You can find out more on our website, schoolhouseconnection.org. We encourage you to reach out if you have any questions. We also publish questions that we receive. So chances are, if you have a question, we've likely answered it, and you can find it on our website as well. During our hour, which I think will go by very quickly today, we hope that you will leave with these three things. We hope you'll leave with a better understanding of the impacts of homelessness on expectant parents, infants, and toddlers. We want you to learn what our new data reveals about the prevalence of homelessness and access to early childhood development programs. And we especially want you to hear strategies and best practices from providers and systems leaders about how they are increasing access to services for expectant parents, infants, and toddlers experiencing homelessness. And I hope that you'll leave with at least one idea for how you can take action, whether large or small, in your state and community. And with that, I'm going to turn it over to my colleague, Sarah Vrabik. Sarah, take it away.
Thanks, Erin. Hi, everyone. It's so great to be here with you today. I'm Sarah Vrabik. I'm the Early Childhood Senior Program Manager here at SchoolHouse. And I'm going to lead us in a little bit of background today and some context. So we always like to ground our discussions in the McKinney-Vento definition of homelessness, which defines homelessness as lacking a fixed, regular, and adequate nighttime residence. So what this can look like is families staying in motels, hotels, or campgrounds due to lacking alternative adequate accommodations, staying in emergency, transitional, or domestic violence shelters, living in cars, parks, abandoned buildings, or substandard housing, and then also sharing the housing of others due to loss of housing, economic hardship, or a similar reason. And this circumstance of homelessness is commonly referred to as doubled up. And we actually know that the majority of young children and families experiencing homelessness in the United States are in this doubled up circumstance. And it's actually a hidden homelessness because across communities, it's not usually immediately visible. Next slide, please. So we wanted to draw your attention to a recently published New York Times piece, which did a really great job of outlining the day-to-day experiences and challenges of families experiencing homelessness in doubled up circumstances. It's encouraging because it's shining a light and spotlighting this typically hidden experience of homelessness. So we encourage you to explore this piece further on your own time. Next slide, please. Families will often stay with others temporarily because there might be a lack of shelter availability within their community, but there also might be a fear of having their children removed from their custody if they identify as experiencing homelessness. Staying with others can put infants, toddlers, and other family members in harmful situations and vulnerable conditions that may lead to developmental delays. Next slide, please. Homelessness in infancy has been found to be associated with delays in language, literacy, and social emotional development. and these delays can put children at risk for later academic problems. We also know that there is a greater cumulative toll of negative health outcomes the longer and younger a child experiences homelessness, and that even once families are stably housed, the impacts that homelessness in early childhood can have are long-lasting, particularly on children's school readiness. Next slide, please. Perhaps the most significant piece of evidence that we have of this impact is that the high school graduation rate of students experiencing homelessness is 68%. And this is compared to 85% for all other students. And notably, this is the lowest graduation rate of any student subgroup, including students who are economically disadvantaged. High school students who experience homelessness are 10 times more likely to become pregnant or to get someone pregnant. And an experience of homelessness in the earliest years can lead to social emotional challenges and long-term trauma. Next slide, please. So we know these long-term consequences and these potential negative effects that homelessness in early childhood can have, but we also know that access to and regular participation in high-quality early childhood developmental programs can mitigate these effects. And in fact, programs like what you see on your screen have federal requirements to prioritize infants, toddlers, and their families experiencing homelessness in both identification and enrollment. Examples include the fact that families experiencing homelessness are categorically eligible for early Head Start and Head Start programs. And in fact, these programs are allowed to reserve up to 3% of their slots for families experiencing homelessness. States are required to make early intervention services available to infants and toddlers experiencing homelessness. And HUD homeless assistance programs are required to designate a staff person to ensure that young children, including infants and toddlers, are enrolled in early childhood programs. Next slide, please. Even with these prioritizations for both identification and enrollment, families experiencing homelessness still encounter barriers and challenges to accessing early childhood programs. Namely, because often families experiencing homelessness can be highly mobile. They might be moving in and out of different motels or hotels, or going from place to place if they're sharing the housing of others. Because of this high mobility, they may not have on hand all of the documentation that is typically necessary to enroll your child in a program. Examples including immunization records, birth certificates, documents like that. They also may not have access to reliable transportation, and that can create a barrier for that regular attendance. Also, there might be a lack of awareness among the early care providers in their community, both of the McKinney-Vento definition of homelessness and all of the different circumstances that it encompasses, but then also the best ways to reach families experiencing homelessness, to have conversations with them about their housing status, their circumstances, in a way that can engender trust. So now I will turn it over to Erin, who's going to lead us into the all-important data portion of our discussion today.
Perfect. Thank you so much, Sarah. So we wanted to give you this overview so that you understand the impacts of homelessness in the expectant parent, infant, and toddler stages. And now I want to share with you some quantifiables, what we know about how prevalent homelessness is among infants and toddlers. And if early learning connections are so important, then what do we know about how those infants, toddlers, and their families are being connected to those programs? So first, I'll start with what was already known from other organizations outside of Schoolhouse, and then I'll share with you our infant toddler homelessness data report. First, we know that HUD, the Department of Housing and Urban Development, reported a 16% increase in families who were staying in homeless shelters or those who were visibly unsheltered in the 2023 year. 16% increase. And that's among those who meet that narrow definition of homelessness. And so we know that this does not encompass those hidden homeless that Sarah mentioned earlier, those who are doubled up, staying in motels, living in cars. So a 16% increase in what we can see is very significant. We also know that babies are actually the age group at greatest risk of eviction. And this is research from the Eviction Lab that for the first time looked at eviction filing reports to really drill down to households that reported having children, including infants and toddlers, in their homes. And we don't often talk about evictions in this way. We often talk about these issues with adult forward language. And this is part of why having this data is so important. Knowing that a baby is at the greatest risk of eviction is very compelling. And that's why I'm super excited in just a few slides to turn it over to our presenters to learn more about how they are addressing this. You'll also receive a link to these slides just to say really quickly. And so in the interest of time, I won't play this clip from Carl Gershenson at the Eviction Lab, but we did a webinar with them a couple months ago, and their research is very compelling, and I encourage you to check this out.
Let's collaborate.
No, sorry about that. We also know from our partners at 0 to 3 that 15.2% of infants and toddlers live in crowded housing, and that is known to jeopardize child development. And actually 2.9% of babies and toddlers have moved 3 or more times since birth. So when you think about all the things that are needed for healthy development, including stability, consistent routine, safe environments, it's discouraging to hear that 15.2% of our infants and toddlers are not experiencing those things. And then we also know that pregnancy and parenthood may actually increase the risk of youth homelessness. And this is actually the second highest risk factor for young adult homelessness, right after lacking a high school diploma or GED. So becoming a parent is a risk factor for homelessness among youth, which can obviously lead into adult homelessness. So I want to share with you some of our findings. SchoolHouse Connection released our report, Infant and Toddler Homelessness Across 50 States, back in March, the end of last month. And this is a culmination of different data sets that we analyzed in partnership with the University of Michigan Poverty Solutions Center. And we found that across 50 states, there are nearly 365,000 infants and toddlers experiencing homelessness, ages birth through 3. And it's important to note that this is an undercount. This is an underestimate, because this data estimate is based on the number of first graders who are identified as experiencing homelessness. We know that not every child experiencing homelessness is seen and identified. And so this estimate is a conservative estimate. We can guarantee that there are, unfortunately, more infants and toddlers experiencing homelessness. And unfortunately, only 11% of them are enrolled in an early childhood development program for which they are age eligible. And so in our report, we included data from Early Head Start, data that local education agencies collect on children who are not yet school age, specifically a birth to 2 category, and also some home visiting programs. We were able to include Parents as Teachers and Healthy Families America data in our report. Couple caveats: we were not able to include childcare data. It's not for lack of trying. That data does exist. And so we encourage you to reach out to your state's childcare subsidy office to find out and ask them for the reported number of families experiencing homelessness who participate in your childcare subsidy program. That data is collected at the state level. It is reported at the federal level, but we were not able to access it through the Office of Child Care for numerous reasons. So the takeaway here, though, is that 89% of infants and toddlers who are experiencing homelessness are not connected to an early childhood development program. And that is alarming. And that is the question that keeps us up at night, is finding out where these infants and toddlers and their families are and how we can connect them to services. So again, just our key takeaways, infants and toddlers experiencing homelessness are significantly under-enrolled in early childhood development programs. We also noted that data about expectant parents experiencing homelessness is severely lacking, and that is where we would like to learn more and be able to report more. And we also noted that few states take full advantage of the flexibilities that are offered in order to support expectant parents, infants, and toddlers experiencing homelessness. And so we are hopeful that our conversation today will bring to light some of the recommendations that we included, including for state agencies and state advocates. Our report also lays out recommendations to other levels, and we'll put a link to it in the chat. This is my contact information and Sarah's contact information. I want to keep moving us along because the people I really want you to hear from are the ones doing the actual work. And so we have an amazing group here with us today. And I'll say, please, as you're listening and learning, please share any questions in the chat. We'll reserve time at the end to go back with any questions that you have for this group about the work that they're doing. So please do share any questions in the chat. We're going to start today with Shawanda Jennings, who is with Home Visiting for Homeless Families run by Start Early in Illinois. After Shawanda, we'll turn to a wonderful panel from Pennsylvania, Omari Baye, Tracy Duarte, and Dr. Grace Whitney. And then we'll round it out with Kate Brand from Horizons for Homeless Children in Massachusetts. So with that, I'm going to turn it over to Shawanda. Thank you so much.
Thank you, Erin. That was a great introduction. I believe everything you talked about initially, we actually started our project here at Start Early. So everyone, I'm Shawanda Jennings. Like Erin said, I work with Start Early. I am the project coordinator for our Home Visiting for Homeless Families project. The project has been up and running since 2013, so about a little over 10 years now. And so visiting for families.
I'm sorry to interject, Shawanda. I don't know if it's just on my end, but you're cutting out and freezing, and we're dying to know what you're going to tell us. So I don't know if there's an angle or a call-in option, but we want to make sure we can hear you.
Are you there, Erin?
Yes, we're here. You cut out
Okay.
there for a minute.
Oh, okay. I'm sorry. So I can start over really quickly. So Start Early, we developed the Home Visiting for Homeless Families project to remove barriers for families experiencing homelessness, to make our home visiting programs more responsive to their needs, as well as to inform changes in policy and practice, and to increase integration and alignment across homeless service providers and home visiting programs. The idea driving our project really is to make home visiting services more accessible to families experiencing homelessness. Let's see, what do we do? So we piloted 3 different models in this project. The first approach was all of our home visiting and doula programs would have all of their staff, the home visitors and doulas, they would have a caseload that would include a handful of families experiencing homelessness on their caseload. So everybody would serve families experiencing homelessness. The second approach we have money from McVie, and some programs have private money to hire a specialized home visitor. And so that one home visitor, his or her caseload would consist of all families experiencing homelessness. And then the third approach that we launched was actually training parent educators and parents as teachers specifically that worked in shelters to provide home visits to those families that live in the shelter. So, there's no one preferred model, but those are just the 3 different approaches that we decided to launch just so that we could learn more from the field how, what modifications and what considerations needed to be made in order to best serve families experiencing homelessness. So also a part of the project, we reached out to healthy families as well as parents as teachers, and we had an agreement with them that allowed the programs that were participating in our project to implement some flexibility and some adaptations. Again, these flexibilities and adaptations are really so we can learn from the field what's the best recipe, what's the best way to serve these families. What are things that we need to consider as funders, as evidence-based home visiting programs and models? What are things that we need to consider when serving this population? So some of the things included enrolling mothers through the age of 25, being able to enroll babies up to 12 months, continuing to serve families as they move in order to ensure that the continuity of services, reducing caseloads to be able to, to account for the additional time it takes to serve this population, to disregard or to be a little flexible on completion rate requirements. We know a lot of funders have outcomes, right? But we really wanted to target the services and see what it really took to make sure that we're servicing the families with fidelity. And sometimes that meant because our families are highly mobile, we might not meet all of the completion rates sometimes. But in this project, that's okay. We just really need to see what it takes to serve the families and be more responsive to their needs. Using active status instead of creative outreach was another flexibility and modification that we use. We know families that are highly mobile, it takes a lot more time to engage them sometimes. And so instead of putting them on creative outreach, keeping them on active status just really helps us learn more about what's the right dosage, right? What's the right frequency of home visiting, and what kind of considerations we need to consider because they are highly mobile. Using alternative methods of communication and home visiting families at non-traditional locations. Those are all things that we implemented as a flexibility and adaptation strategy so we can learn more. We have a lot of lessons learned. We've done some focus groups. We've invited Chapin Hall to come in and evaluate our project. And we just continue we have a home visiting for homeless family advisory committee that we convene on a quarterly basis. And we bring these groups of people together so that we can continue to learn what works best for serving our families that are highly mobile, both doula families as well as parenting families. And so things that we've learned, our home visitors provide families with parenting and child development education, baby supplies, referrals for other services, emotional support. We also learned that the home visitors and doulas also need support as well. They need training and support around how to work with this priority population, and so they can respond to their needs in crisis. We also just really focused on being able to provide an adequate supply of safe and affordable housing. We also know that having comprehensive services is key. It's not enough just to quickly house a family. You have to wrap that family with supportive services so that they can thrive and not just survive. That's the big thing here. Other things we've learned is that we need to continue to promote awareness for this increased flexibility, and we need to document how home visitors can leverage this flexibility so that we can be more responsive and increase families' access to this intervention. We need to provide home visitors with additional training, like I said, implement the core care model for homeless families, give families the option of doing virtual visits Post-pandemic, we learned that our numbers did not drop. Our numbers actually rose during the pandemic. Families that are typically kind of shy or embarrassed to have you come into their home because of their environment were still willing to engage, especially when we introduced the option of virtual visits. And so that allowed us to continue to work with families, continue to help increase our outcomes for these families, and to improve the trajectory of the children and families experiencing homelessness. So definitely providing that option of doing virtual visits was very, very important. Another thing that we've learned is because the relationships that we build, our home visitors and doulas are building with these families, we're able to really connect with them and engage them and retain them in home visiting services. And when we look at our data of our families that are participating in this project compared to the families that are not in the project,
Shawanda, I'm sorry to interrupt again.
targets.
Can you go back and repeat that? You cut out right when you were about to tell us the difference between families who were in the project and not in the project.
Okay, I'm sorry. I am getting a notice that my internet connection is unstable. I apologize about that. I was just quickly saying that our numbers are really showing that our families who are in the project, but compared to our families that are not in the project, are doing just as well, comparatively well, as far as the developmental outcomes, as far as the social emotional outcomes, having a primary service provider, care provider. All of our outcomes are just really maternal health and depression and anxiety screenings. All of our outcomes are comparative to our families who are not experiencing homelessness. And we attribute that to the relationships that our home visitors and doulas have established with these families, the intensity of service that we are implementing with these families, and then just the trust that we have built with them. We're really seeing a difference. And so that is really letting us know that home as an intervention is really the way to go with serving these families. And I have much more to share, but I don't want to take up too much time. Erin will share my contact information. You all can drop questions in the chat. Thank you again for allowing me this time to share with you all a bit about what we're doing at Start Early. And I look forward to hearing from all of the other speakers. Thank you.
Thank you so much, Shawanda. That was wonderful. I'm hoping we'll get lots of questions and reactions in the chat and encourage our participants to share. I'm going to turn it over now to Tracy and let her lead the way for the folks from Pennsylvania.
Okay, everyone see the screen okay? Great. Good afternoon. My name is Tracy Duarte. I'm the director of the Pennsylvania Head Start State Collaboration Office. Thank you, Erin and Sarah and SchoolHouse Connection for inviting us to be here today. I'm going to just very briefly begin the presentation by providing an overview of sort of the historic timeline of some of the things, the big things we've done in Pennsylvania around data and otherwise to try to increase the number of young children experiencing homelessness that are enrolled in early learning programs. So in 2018, a colleague of mine, Joe Willard from Hopeville, who was not able to be here today, decided very organically and informally to put together a stakeholders group where we could bring together statewide systems representatives who are in some way touching the lives of young children experiencing homelessness to the table together so that we could begin first by really looking at the data in Pennsylvania to determine where are we, what are the gaps, and what sort of strategies or efforts can we make to improve not only our data collection and reporting, but also improve the number of the number of children that are enrolled in high quality early learning programs, and improve the knowledge of our early learning programs and their staff around the McKinney-Vento definition and providing services to young children experiencing homelessness. One of the first things we realized is that our Head Start programs specifically weren't necessarily partnering or knowledgeable of the providers in their local areas, such as our Pennsylvania Homeless Education Team and other, excuse me, family shelters. So we did a series of 9 regional roundtables where we brought all of those folks together for a face-to-face meeting, provided some information about Head Start, how to refer to Head Start for those McKinney-Vento liaisons and other housing and homeless providers. And then we also provided information on the homeless education program, McKinney-Vento services, and housing and homeless providers for the Head Start and early Head Start programs, and gave them plenty of time to network and share each other's contact information. Those proved to be extremely successful, and we've been asked ever since to continue to do those. Of course, then the pandemic hit, and we were all sort of sent home to do our work. And the first thing we did in Pennsylvania was acknowledge that many of our homeless shelters did not have the technological capacity to assist families and children with their needs with living in the shelter. So were they able to access the services that they needed provided to them via internet and via computer? Did they have the capacity of internet to allow folks living in the shelter to utilize services online? And certainly young children who may be given virtual options for learning, we wanted to make sure that they all had the technology necessary to be able to provide that for the families. So we did award about $750,000 worth of technology grants to family shelters, domestic violence shelters across the Commonwealth. In 2021, as we were beginning to come out of the pandemic, I was able to, with some collaboration office dollars, contract with Dr. Grace Whitney, who you'll hear from next, to really help the Collab office, which is a office of one, and they typically are in most states. So Grace was able to come on board and help me to really focus on doing some professional development and some deep dives into the needs of our system partners. So we did a number of community of practices with partners such as early intervention, our pre-K counts team, some of our Office of Child Development and Early Learning providers. We offer professional development for all of these systems as well as the communities of practice. We were able to get the Supporting Children and Families Experiencing Homelessness learning modules that are located on the Early Childhood Learning and Knowledge Center website into our Pennsylvania Professional Development Directory, or registry, excuse me, so that our providers can take those credits through our PD registry and take those modules through our PD registry and earn credits for doing so. We wrote a series of data briefs that you'll hear more about shortly. We looked at all of our Office of Child Development and Early Learning's policy and regulatory expectations, and Dr. Whitney really studied all of them and developed a brief for our Office of Child Development and Early Learning leadership on recommendations to better provide better services to young children experiencing homelessness. Finally, just a few other things that we did here. Dr. Whitney was able to develop a few beautiful infographics, one on the mental health and one on health impacts of homelessness on young children. And I did put links to those in the slides that you'll receive afterwards, and you are more than welcome to use those. Feel free to please pull them off of our website, change up the logo, take Pennsylvania off, add your state on, and use them for yourselves and your states. We've actually done a number of years of data collection and analysis for the collaboration office needs assessment with all of the Head Start grantees in Pennsylvania. And we continue to do that year after year to collect better data on how our Head Start and early Head Start programs are serving young children experiencing homelessness. A number of us have written Substack articles for a Substack account that we have here in Pennsylvania. We've placed a number of resources, many of which are SchoolHouse Connection resources on our webpage for the collaboration office. Dr. Whitney and I recently did a 6-part series on McKinney-Vento, a virtual series for all of our Head Start and early Head Start grantees, and we had over 250 people register for those, which I thought was really it was wonderful, and I think it was a sign of the need for additional information. Finally, we do a number of things. Word is out now. So across Pennsylvania, when there are conferences or meetings, we're frequently asked to speak on homelessness at those events. These are the 3 primary briefs that we've done, the data briefs that we've done in the past couple of years. The first one is the original brief on early childhood homelessness and participation of young children experiencing homelessness in early childhood programs. The second one is specific to infant and toddler participation. And the third one is an update on the original brief that we just finished this year. And Dr. Whitney, next up, is going to take us through some highlights of that brief.
Okay, thank you very much, Tracy, as a setup. And yes, we are going to talk a little bit more about the kind of trajectory we took with these data briefs. And we're going to highlight here today the state level update, which was our next step following the earlier infant toddler brief. We began, as Tracy said, with the birth to 5 brief. We focused on infant toddlers and toddlers in the second brief, which really taught us how much we did not know, and then developed the state level update to dig deeper into all birth to 5 data to offer ways to organize age cohort data separately, and then to compare age cohorts to learn how they differed and were similar. We defined infants and toddlers as children before their 3rd birthday and preschoolers as 3 and 4-year-olds. I know the SchoolHouse Connection report defined infants and toddlers as children up to their 4th birthday, and some states can vary in the age of school entry, which can add 5-year-olds to preschool years. So this is something important to keep in mind. Considering all of that, above we have one of the tables in the state level update, which shows the disproportionate access in Pennsylvania for the 2 age cohorts to key early learning programs. Of the total number, about 23% of infants and toddlers, of all infant and toddlers, compared to 60% of preschoolers, were participating in any early learning program. Next slide. But what we also learned through this process is that data collection and interpretation is very complicated. So what is the story? It's complicated and caution is required because age cohorts and time periods vary, data collection and reporting systems vary, definitions vary, as do the ways service sectors apply the various definitions. Training and proficiency in using the definitions vary. And since child identifiers are not used, data may be redundant. And local communities are really in the best place to discover the real story. Note that we will next be digging deeper into children who fall in between, children who are staying with relatives or friends informally who meet the McKinney-Vento definition of unaccompanied and who typically fall outside of formal foster care, thus unable to receive any service accommodations and financial supports. And hopefully we will be able to dig a little bit deeper into that in our next brief, but this brief begins to share some information on formal foster care. Next slide. So in the state level update, there is extensive appendices containing links to obtain local data and 2 templates that communities and other states can use to organize and explore their own status. Template A provides a format for organizing data to identify trends over time. And here you'll see template B, which has a format for organizing data to better understand participation. Note that we concentrate on both children who meet the McKinney definition of homelessness and those who are in formal foster care situations. Our hope in these templates will that these templates will help us and others clarify ways to take action to enhance access to early learning for children facing adversity. Several considerations might include: how do we address definition confusion regarding homelessness, foster care, and age? And are there opportunities to rethink designs for capacity and service type to better serve priority populations or age cohorts? Our hope is that our work can guide others, and that is what did happen with Philadelphia. And next you'll hear from Omari Bai about what they have done in Philadelphia, adding to their work that had already been done through the Bell Project. Next slide.
Great. Thank you for that wonderful introduction, Grace. I will jump right in. So what does Bell do? Bell works to increase equity and access to high-quality childhood education for children and families experiencing homelessness and housing insecurity. And I know that's a mouthful. We started in 2016, later expanded in 2021 to support permanent supportive housing, and expanded again in 2022 to create playful learning installations in shelter programs and make them more developmentally friendly. Next slide, please. Now, what are some of our key activities? Bell has 7 key activities, and those are childcare and pre-K discussions with families and staff, meet and greets, enrollment drives, because we found that it's the easiest way to support families. We bring resources to them and eliminates the travel and childcare barriers. The use of the shelter self-assessment, which allows emerging housing directors to measure the developmental friendliness of their programs and identify areas for improvement, which we then go and make investments into those programs to meet their needs. Stakeholder convenings, much like Children's Work Group and our Bell Summit, are opportunities to bring providers across the system together to build consensus about the best ways to advocate for and meet the needs of children experiencing homelessness. Staff trainings, and those trainings can range anywhere from self-care and kindergarten readiness to ACEs and discussions of adverse childhood experiences and the way that they impact development. We do a lot of family advocacy. We lead campaigns, through Hopeful and with organizations like Children's First and First Up. But when we recognize system barriers like questions on applications that don't take into account that families may not have a fixed address, we push to have those questions added to applications, much like what was done for the Early Learning Resource Center's application for subsidy. Next slide, please. So the major point of this slide is that children ages birth to 2 make up 8% of the overall total of children experiencing homelessness in Pennsylvania. Next slide, please. And when we drill down looking at Philadelphia specifically, we see that 13% of children experiencing homelessness are infants and toddlers in Philadelphia, compared to the 8% in the previous PA slide. Next slide, please. And of all children experiencing homelessness in this particular age range of birth to 5, infants and toddlers represent 48% of all children. Next slide. Now, our team has been working to know how many of these children are in early child education programs and using our resources to address barriers to enrollment. And through reporting and cross-systems collaboration with partners like the Office of Homeless Services, the School District of Philadelphia, and Early Intervention, we are now able to inform school district Head Start programs where young children reside within the emergency housing system, and a representative from their office will go to the housing program and complete an application for enrollment with the family. Additionally, the Philadelphia School District Head Start programs now help to identify spaces in their district-operated classrooms for children experiencing homelessness based on the data received from Bell. Next slide. So we were fortunate to have Tracy and Grace's statewide briefing to use as a template when producing a report specifically focused on supporting children experiencing homelessness in Philadelphia. Though many of them aren't in the room today, we also owe great thanks to Philadelphia's emergency and supportive housing providers In addition to providing us with rich qualitative data, they were instrumental in the creation of the Promising Practices Handbook and willing to share freely about their collective experiences. During our September Bell Summit, we invited shelter directors, case managers, and education liaisons to Hopeful to discuss the effectiveness of interventions and supports being offered to families when they enter the emergency and transitional housing system. Emergency and supportive housing. We then discussed the gaps and what was missing and used information gathered to create policy recommendations and a resource guide for emergency housing staff to utilize during the intake process. Next slide, please. And in my final slide, I just wanted to acknowledge our funders and just say we thank our funders, Vanguard Strong Start for Kids, and the William Penn Foundation, United Way of Southeastern PA, and Southern New Jersey. Thank you.
Thank you,
Thank you,
Grace and Omari. Our contact information for myself and Omari is here on the slide. Again, thank you very much to Erin and Sarah for having us.
Thank you so much to our Pennsylvania colleagues. I'm going to turn it over to Kate to close us out. And Kate, I'm going to ask you to try and do the impossible and leave us a few minutes at the end to get to some questions that are coming in the chat, but take it away.
Thought I'd unmuted myself. My apologies. I think I'm sharing my screen, but maybe not. Am I?
I'm not seeing it yet.
Okay, well, we just did that, but let's try again. How are we? Is that okay? Great. So I'm the CEO of Horizons for Homeless Children. I believe you can now see the screen. And we've been around for 30 years in the state of Massachusetts, doing many of the things that many of you are also doing. And it's exciting to see so much progress being made in other places. So thanks everybody for all your work. I wanted to spend a minute talking about what we do at Horizons in a large context. So for some reason, my slides are not advancing, so I'll just forget that. But what we do is three things at a macro level. We have a child care facility that we have built that serves 225 children every day who are all in the emergency assistance system in Massachusetts. And we have a very sophisticated early education program with lots of wraparound services for those children. In addition, we too go out into the emergency assistance system and we put safe and healthy environments into those systems for children to play in. And we have trained volunteers that we send out to play with the children. The third aspect of what we do is that we have a very active policy endeavor where we have in fact led a statewide convening, trying to get additional services to children in Massachusetts experiencing homelessness. That statewide convening has precipitated extraordinary, actually positive outcomes in the last year when we are suffering from an acute issue around migration. I'm sure some of you have read that Massachusetts has doubled its homeless population in the past year and a half. It has doubled because we have an enormous number of immigrants coming into the community, which I'm excited about, but that is not necessarily shared by everyone in this world, which is too bad. But we have this extraordinary community and we are out there supporting them every day. And I'm trying to figure out how I can gain control over the slides to zero in on what we're talking about for specifically what we do in our classrooms, which I thought might be of interest to folks. So what we do, just particularly in 0 to 2, is apparently I'm not listed, so I can't control my slide. But in any case, so we believe very firmly, here we go. When you're working with 0 to 2 in the homeless space, you have to support both parent and child. And so we use asset-based practices, supporting both parent and child, and also the person who is the teacher in this relationship, which can take on, I would say, an outsized proportion of some of that early relational health and healthy relationships work, because the context they're working in is parents are extremely fraught and oftentimes just trying to survive, and therefore caretakers, teachers take on an additional role. So obviously, what we try and focus on in terms of supporting our children is that you'll see on this slide, I tried to keep it simple. We try to have very healthy environments inside of our early education program. We have a state-of-the-art building. The classrooms are light and bright. We think of the classroom as the third teacher, and all children have easy access to an outdoor healthy space in our child care center. That door right there is actually the door to a developmentally appropriate playground. We take very seriously the trauma-informed nature of our teachers. We have a core curriculum all teachers are asked to go through before they enter into our classrooms. That includes Circle of Security, Brazelton Touch Points, and the Pyramid Model. We feel that all three of those are absolutely critical to establishing the right kind of relationship, both with a child that supports that early relational health, as well as with the parent as the first teacher. We also have early relational health specialists working inside of all of our classrooms with our teachers and our children, supporting both the educator and the child in building that responsive relationship that is so critical to brain development, particularly in the areas of 0 to 2. So when it comes to our classrooms, this is really what we're focused on in supporting those children 0 to 2. My final piece, I'm sorry, this is very rushed and I apologize. The final piece is really supporting the caregiver, and that is the parent. And when a child is enrolled at Horizons, their parent is also enrolled, and their parent gets a coach. And that coach works with an evidence-based mobility mentoring coaching model, and that is attempting to help the parent set goals and also helping the parent get access to community supports throughout Massachusetts. We try to train our parents in play and early relational health using the Circle of Security training and other training we have in-house, because we know that it is often the case that parents have not been played with as children, oftentimes those experiencing homelessness, and therefore don't understand in many cases and have never been exposed to the very positive nature of play in terms of the development of their child. Our teachers are using the touch points approach to family engagement with a parent, and that really leans on what we call anticipatory guidance. So often parents, particularly when they're experiencing acute disruption in their lives, have a lot of doubt about their ability and their understanding of their child. What this does is use the child's behavior as the guide and the parent as the expert. We want to be supporting parents. We want them to believe and feel that they are the experts in their child. And that's why we train our teachers to use this approach. It's really building up that relationship and building up that parent. We believe it is key to success. Also on site at Horizons, we have a full on-site family clinic, which is critical to supporting both parent mental health as well as the child's overall health and behavioral health needs of both. I'm trying to stay within your time horizons, and I know that was exceptionally rushed, so I apologize, but happy to at some point take any questions or work with you offline, any of you that may have questions.
That was perfect, Kate. Thank you so much. Thank you to all of our panelists. I know this was a lot of information for our participants, so I'll assure you we will send out slides after so that you'll have this information at your fingertips. I want to acknowledge a few things that have come into the chat. One is thank you to our Pennsylvania team for sharing the briefs. And there was a question about Pennsylvania in particular, if there was county level data, and it sounds like they can access that through your briefs. There was a question that came in for Kate. It says, I'm wondering if all of the shelters where you have play spaces use the self-assessment tool, or if you can talk about how you're able to assess those spaces.
That's a great question. The answer is we do not do a lot of assessments in there. We have tried that with families and not found it terribly successful. But if one of you has a great assessment tool for something like that, I'd be fascinated. We know how many children visit, and it's 11,000 visits a year. The question is, what is the success? And they're really meant to be free play periods, so we don't tend to evaluate them. It's just healthy access to play.
Thank you so much for that. I had a question come in directly to me earlier that I want to acknowledge and offer to our participants for any comments. The question was whether or not we have data that is specific to homeless shelters and how many infants and toddlers are staying in homeless shelters. The short answer is that at the national level, SchoolHouse Connection is not able to access national aggregated data. Two things that we do know though. One is that half of all shelter residents are under the age of 6, and so that is significant. And we also know that among school-age children, about 10% of those experiencing homelessness are staying in shelters. And so you could apply that 10% to your infant toddler homeless estimates for your state. I want to quickly open it up to our panelists though to see if you all in your states and communities, and I know Omari shared a slide that does disaggregate that data, but I'm curious to know if there are other state level sources that our participants could try and access in their home states.
Erin, we were able to get quite a bit of data on young children from the AHAR, the annual, what is it, the HUD report, part 2. That does actually include data on infants and toddlers who are in either shelters or transitional housing. But it doesn't come out every year. And what we found in Pennsylvania was that it was not aggregated by state. It's reported by local community. So Hopeful actually did a contact for all of the COCs in the state to be able to put that data together. What you'll notice is that Hopeful was also able to dig deeper and look at not only shelters and transitional housing, but actually go into rapid rehousing and diverted families, which is the first that I've seen in that kind of arrangement. And that too can be incredibly helpful.
That's wonderful to know. Thank you so much, Grace. I want to end us here because we have a few wrap-up comments, and I know that you're going to have a survey pop up for you from the NCIT folks right now. So thank you so much for that, right on time. As I said, we will share the slides from today's presentation with you, which will include links to all the reports that have been shared. And I hope that we've made good on our promise and our objectives. I hope that you are leaving with a better understanding of the impacts of homelessness on infants and toddlers. I hope that you are now more aware of the data and the quantifiables. And I do hope that you have been able to take away one idea from these amazing presenters from Shawanda, Tracy, Omari, Grace, and Kate. And I want to thank you all for joining. Thank you to our participants for being so engaged. And with that, have a wonderful afternoon. Thank you so much, everyone.